Sigmoidoscopy surgical device. Look at this picture, shows that sigmoid colon, large intestine, and scopy, a detail going on. Introduction. Sigmoidoscopy is a medical device used to examine the lower part of the large intestine, specifically the sigmoid colon and rectum. The procedure conducted using the device is called sigmoidoscopy. It allows healthcare providers to diagnose and evaluate conditions affecting the lower gastrointestinal tract, such as polyps, tumors, inflammations, and sources of bleeding. A definition: a sigmoidoscopy is a flexible or rigid tube with a light source and camera that enables doctors to visualize the inside of the sigmoid colon and rectum. The flexible version is more commonly used as it provides a better view and is less uncomfortable for the patient. Parts. Look at this picture, shows that parts of sigmoidoscopy. First part, insertion tube, a long, flexible or rigid tube that is inserted into the rectum. To light source provides illumination to visualize the internal structures. 3 camera attached to the end of the tube, allowing the physician to view the colon on the monitor. For air water channel used to insufflate air to expand the colon and to flush water for better visibility. 5 suction channel removes any fluids or waste materials from the colon. 6 control handle allows the physician to maneuver the scope for better visualization. 7 biopsy channel, a part that allows instrument to be passed through to take tissue samples for biopsy. Uses. First use, diagnosis conditions like diverticulosis, diverticulitis, ulcerative colitis, and Crohn's disease. To detect colon polyps or cancers. 3. Investigate causes of rectal bleeding, abdominal pain, or changes in bowel habits. 4. Perform screening for colorectal cancer or pre-cancerous growth. 5. Monitor the progression of previously diagnosed gastrointestinal conditions. Precautions. One, bowel preparation. Patients are typically instructed to clear their bowels before the procedure using laxatives or enemas. To avoiding certain medications, anticoagulants or NSAIDs may need to be temporarily discontinued to prevent excessive bleeding. Three, informed consent. The procedure is risk and benefits should be explained and consent obtained. 4. Infection control, sterile techniques and proper equipment sterilization are essential to prevent infections. 5. Monitoring for complications, bleeding, bowel perforation or severe pain are rare but serious risk. How to use? On patient preparation, the patient is usually asked to lie on their side with their knees down up. Bowel preparation is conformed to instruction. The lubricated sigmoidoscopy is gently inserted into the rectum. The physician carefully advances the scope through the rectum and into the sigmoid colon. 3. Visualization. Air is introduced into the colon to inflate it, allowing better visualization of the colon walls. The light and camera transmit real time images to a monitor. 4. Inspection. The physician inspects the colon lining for abnormalities like polyps, inflammation or tumors. 5. Biopsy if needed. Instrument can be passed through the biopsy channel to take tissue samples. 6. Removal. Once the examination is completed, the scope is gently withdrawn. 7. After care, the patient may experience mild cramping or bloating due to the air introduced during the procedure but usually recovers quickly. In conclusion, sigmoidoscopy is a valuable tool for diagnosing and sometimes treating conditions of the sigmoid colon. It requires proper training, attention to detail and adherence to safety procedure to ensure effective and safe use for both patient and healthcare provider. Thank you. Have a nice day.